Welcome to The Explainer. Today, we're diving straight into something that is absolutely vital. We aren't just talking about a piece of medical literature here, we're looking at a literal survival tool for modern healthcare workers on the front lines. If you're operating in a medical system where resources are incredibly tight, but the daily demands are just unimaginably high, you know you need a lifeline. And that is exactly what we're unpacking today, the recently updated Uganda Clinical Guidelines, or UCG, for 2023. We're going to see exactly how this incredible document is structured to empower practitioners to deliver the highest standard of care without losing their minds in the process.
Let's be real for a second. If you're a practitioner today, you probably feel exactly like this, just completely crushed under a mountain of paperwork. Being a health worker today means you're constantly drowning. You've got the weight of new diseases, rapidly evolving treatments, shifting national priorities, and these super complex new diagnostic protocols. Medicine is an ever-evolving field, right? The sheer volume of knowledge required to just get through a single Tuesday afternoon shift can be incredibly overwhelming, especially when you're trying to juggle actual patient care with endless administrative demands.
Okay, let's dive into this. How on earth does a modern health worker actually keep up with all of these new diseases, treatments, and protocols without completely drowning in information overload? Our healthcare systems are under immense pressure right now, and practitioners desperately need a clear, practical lifeline that cuts through all that noise and gives them immediate, evidence-based answers right at the point of care.
To really understand the solution, we first need to understand the battlefield. Let's shift our focus to the specific context of Uganda's healthcare system. Uganda is making this massive, truly commendable push toward universal health coverage. They're working so hard to provide universal access to things like antiretroviral therapy, and they're focusing heavily on maternal and child health. But here's the catch. They're doing all of this while battling an incredibly complex disease burden that stretches limited resources to their absolute breaking point.
This slide brilliantly illustrates the problem. It's a triple threat fighting for those limited resources. Health workers aren't just fighting one type of war, they're fighting three at the exact same time. First, you have the persistent heavy hitters, infectious diseases like HIV, malaria, and TB. Second, you've got these terrifying emerging threats like COVID-19, Ebola, and yellow fever. And third, a massive surging wave of non-communicable diseases. We're talking diabetes, hypertension, cancer, mental disorders. A practitioner literally has to seamlessly pivot from managing a severe malaria case to identifying a viral threat to counseling a diabetic patient all in one afternoon. It's wild.
So enter the hero of our explainer, the Uganda Clinical Guidelines 2023. This isn't just some dusty textbook you leave on a shelf. It's the ultimate, updated weapon designed specifically to combat this massive three-pronged disease burden. Compiled by the Ministry of Health Update Task Force, leading medical consultants, and experts from across the entire country, this document is basically a highly concentrated dose of national standard treatments.
Let's look at exactly what this is. The UCG is an evidence-based, cost-effective standard of treatment designed to maximize health benefits with limited resources. Now, the absolutely crucial point here is that word cost-effectiveness. The guidelines don't just tell you the absolute best treatment in some theoretical perfect world with unlimited money. No, they tell you the best, most practical treatment for the real world. For example, the text points out that yes, a liver transplant is a highly effective way to treat terminal cirrhosis. But let's face it, it's entirely unaffordable in this context. So the UCG guides the system to invest those same limited funds into treating patients with chronic hepatitis B way before they ever reach the stage of needing a transplant. Actually, scratch that. It's more like a strategy to get the absolute maximum health benefit, the best value for money for the entire population.
So, what makes this 2023 edition so special? I honestly like to treat this like a major product launch, because the user-friendly upgrades in this manual are genuinely exciting for anyone practicing on the ground. The authors actually went out, conducted a user survey to see what frontline workers really needed, and man, they delivered.
The result is this radically updated toolkit. They added entirely new chapters focusing on primary care for COVID-19, self-care, and hypoxia management. And because of that triple threat we just talked about, they significantly expanded the focus on non-communicable diseases like stroke and COPD. They also introduced a new palliative care ladder to make assessing and treating pain so much easier. Oh, and this is amazing. They even included high-quality photographs of common venomous snakes in Uganda right there in the manual. This way workers can accurately identify the snake and give the exact right antivenom. Plus, fascinatingly, for the very first time, they've included a purely herbal preparation utilizing selenium for stress management. These aren't just abstract ideas, they are highly practical additions that directly, literally improve patient outcomes on the ground.
Another incredibly powerful structural tool in the manual is the level of care or LOC system. Whenever you look up a treatment, the guide explicitly tells you the level at which the condition can be appropriately managed. It ranges from HC1, which is your community level, all the way up to NR, the National Referral Hospital. This is a total game changer. It means a rural health worker instantly knows if they can initiate treatment right then and there, or if the guidelines dictate that this specific patient needs to be referred up the chain for complications. It just creates this beautifully seamless, safe flow of patients through the whole national health infrastructure. Now, to make this 2023 edition as usable as humanly possible, the authors made a major structural change. They instituted what I call the Great Divide, officially separating the clinical guidelines from the medicine supply list.
Now, what's really interesting about this slide is how separating these two lists solves a massive, real-world practical problem. In the past, having both of them jammed into one book just made it way too bulky. By removing the Essential Medicines and Health Supplies list, the EMHSLO, from the UCG remains a physical, pocket-friendly book that a doctor or nurse can actually carry around on their rounds. Meanwhile, the EMHSLO functions as the backbone for procurement. It ensures that the vital medicines the UCG recommends are actually sitting there in stock in the pharmacy. It's brilliant. One tells you what to prescribe, and the other ensures the pharmacy actually has it. All right, so we have this brilliant tool. But, a tool is only as good as the hands that wield it. Let's transition into a quick user guide. The Ministry of Health explicitly wants workers to treat this not as some dusty textbook sitting on a high shelf, but as a practical, daily instrument.
So here are the actionable steps for mastering it. First, familiarize yourself with the structure, the order of diseases, and those LOC acronyms we talked about. Second, practice. Run through scenarios and practice looking up conditions in the index before an actual emergency happens. And third, this is big, keep it at your workstation. The authors actively encourage healthcare workers to open the book right in front of their patients. Far from making you look like you don't know what you're doing, consulting the standard guidelines openly demonstrates to your patients and your colleagues that you care deeply about delivering the highest quality, evidence-based care.
Let's move to and see how this builds. Ultimately, this guide belongs right alongside your stethoscope, your thermometer, and your medical bag. It isn't just a supplementary text. It is a fundamental piece of clinical equipment. Think about it. You wouldn't try to assess a patient's lungs without your stethoscope, right? Well, you shouldn't try to navigate Uganda's incredibly complex medical landscape without the UCG.
Which leaves us with this final provocative thought. In an era where new diseases are constantly emerging, resources are stretched incredibly thin, and the sheer weight of medical knowledge is practically crushing, evidence-based simplicity is the ultimate superpower. Will the 2023 Uganda Clinical Guidelines become as essential to your daily practice as your stethoscope? If you truly want to conquer the modern medical burden and deliver the absolute best possible care, the answer has to be yes. Thanks so much for joining us for this explainer. Keep learning and keep saving lives.